The use of alcohol and other substances during adolescence and early adulthood has become a serious public health problem in Uganda, and the global burden of disease by the World Health Organization projected that tobacco, alcohol and illicit drugs were the leading cause of mortality globally. It is against this backdrop that Makerere University School of Public Health, in collaboration with the Uganda Harm Reduction Network and the Medical College of Wisconsin, engaged in implementation of a 4-year research study entitled Integration of Buprenorphine into a combination of harm reduction intervention for people who inject drugs in Kampala.
As a country, we have included Buprenorphine on the essential medicines list, but only at the National Referral Hospital, and that is Butabika. There are many medicines that we use in mental health or to care for people with mental disorders, and we place them at different levels depending on the human resource there, on the infrastructure, and the ability to follow up and so on. So
last year we conducted a modes of transmission study. There are many results that came out of that modes of transmission study. But for example, the HIV incidence among women who inject drugs was 175 persons per 1,000 population. This against the national average of 2.4 persons per 1,000 population, and against our target of bringing it down to less than 2 persons per 1,000 population. So the problem is huge. The incidence of HIV is higher amongst the female drug users as compared to their male counterparts.
The use of alcohol and other substances during adolescence and early adulthood has become a serious public health problem in Uganda. The World Health Organization projected that tobacco, alcohol and illicit... Ewan Joshua Musamali, a software developer, is one of the few people who have benefited from Buprenorphine treatment and has been off drugs for close to a year. Musamali says that he started abusing drugs during his senior 6 vacation and escalated during COVID-19 and his campus days.
2022 I was using, then 2023 early. That's when everything gets too crazy. Now in the ghetto down there, our friends were dying. Like, you can imagine your close friend dying. Like, I lost over 4 friends in drug life, and I'm like, what are we chasing for in life? Is it really are we chasing drugs for life really, or we have ambitions? Like, what did God give us to do on this world? Like, what is our mission on this world? And then I had to step up. I'm like, this is not right. I have to man up and do what's really necessary. And
Musamali advised fellow youths to desist from drugs and concentrate on their studies or other useful skills that can help them in the future.
Whoever is producing or making the drugs or something, they're trying to keep us down. But we are a serious weapon in the future there. So if at all one can avoid the drug use in life, that's all. You can achieve whatever you want if at all you keep the drugs low.
Twaibu Wamala, the executive director of Uganda Harm Reduction Network, noted that the primary objective of the project was to develop a pilot combination of HIV prevention intervention and also contribute to enhancing harm reduction strategies and programming for individuals who use drugs in the country.
And this research was giving alternative treatment for people who use drugs. So we have been having treatments, MAT treatment center at Butabika, but it was only focusing on high-burden drug users. So that means that people who are not high-burdened could not benefit from the treatment in Butabika. So
most of our people were facing challenges of accessing that distance from where they stay to Butabika is quite long. It's very costly, as much as the medication is free, but it's costly for them to access the service. And that's when we were presented with the opportunity of integrating this treatment into the drop-in center. We welcomed it. This started in 2022. So we're trying to understand how feasible is it to have this treatment being received from the community, giving people take-home doses access to manage themselves without worries of overdose, without worries of diversion, but with the main goal of reducing the harms that are in between their journey of recovery.
Zahara Abigaba, UBC News.